Unit 2, Introduction to Drug Therapy. Here are your objectives, and these are your reading assignments. So, toxic effects of drugs. You will hear often that we're going to be talking about adverse effects whenever we're talking about medications. So, adverse effects are severe side effects that can cause severe harm or death, such as hallucinations, hypotension, or anaphylactic shock. So basically, adverse effects are basically negative, severe effects of medications. Now, sometimes it is used interchangeably with side effects, especially when you're reading some of your medication study guides or medication handbooks. Anyway, next would be side effects. So side effect is a type of adverse effect. So this is more of a milder version of an adverse effect. So they're usually mild, and typically it involves nausea, constipation, sensitivity to light. So these are still like things that we need to consider, but they're typically not as serious. On the other hand, we have idiosyncratic reaction. Idiosyncratic reactions are adverse effects that are unexpected, unintended, and it can be an excessive response to medication, even though the medication was given appropriately. Even if the nurse gave the right dose at the right time and basically followed everything to the T, and for some reason the patient just have this reaction, and this is typically unique to the patient, meaning it is not very common. So side effects are usually pretty common. Idiosyncratic is typically like out of nowhere, unexpected. An example of that is, let's say you typically give Benadryl or diphenhydramine for allergies, and the side effect usually includes drowsiness. And for some people, let's say out of nowhere, a patient experiences restlessness, anxiety, and joint pain. And those are not typical side effects or effects of the medication. Therefore, especially it's very exclusive or unique to that patient, that is considered an idiosyncratic reaction. An allergic reaction, on the other hand, probably most of you are going to be familiar with it, is an immunologic hypersensitivity reaction. So your immune system, right, is reacting to it, resulting from the unusual sensitivity of a patient to a particular medication. So this is also considered a type of adverse drug event or adverse drug effect. Anyway, there are different types of allergic reactions. You have type 1, type 2, type 3, and type 4 allergic reaction. So type 1 is IgE mediated. So typically what you see on a patient is urticaria, angioedema, bronchospasm, pruritus, vomiting, diarrhea, and it can lead to anaphylaxis. So urticaria, urticaria is basically itching, angioedema is inflammation of the vessels, bronchospasm is spasming of your respiratory tract, pruritus is itching, vomiting, diarrhea, and then anaphylaxis is basically a severe allergic reaction. Type 2, on the other hand, is cytotoxic. So typically, when you're looking at your patient, if they're having a type 2 allergic reaction, they may show signs and symptoms of hemolytic anemia. They may have neutropenia and thrombocytopenia. So based on this, typically this will be seen. So it may be asymptomatic if you're just looking at the patient, but this is more detected through blood work, unless it's quite severe that you may start seeing signs and symptoms of severe anemia. Type 3, on the other hand, is an immune complex type of allergic reaction. So typically it can cause serum sickness, fever, rash, arthralgias, or joint pain, lymphadenopathy, or basically lymph enlargement and lymph sensitivity or tenderness, urticaria, that would be rashes, itching, glomerulonephritis, basically inflammation within the kidneys, and vasculitis, which is inflammation of the vessels. Last but not the least, you have type 4 or delayed or cell-mediated allergic reaction. So this typically leads to allergic contact dermatitis. So it can be more of a rash, and it's probably going to be similar to when you're looking at it without really knowing the etiology or origin of the rash. It can look like your typical dermatitis or your typical atopic dermatitis or eczema. Anyway, so if you see that a patient is having an allergic reaction, these are going to be your interventions. So as a nurse, right, when you're in the middle of administering, let's say you're administered one pill and you're about to administer the second pill, and you're noticing that the patient is having any of the symptoms mentioned, what you do first is definitely stop the medication, especially if you haven't completely given the medication yet. And the second part would be look at your patient. So you want to examine your patient. And then depending on what's going on with your patient, you have to use your clinical judgment and critical thinking skills at this point, right? Depending on the severity, you may have to call for help. So one of the people that you want to notify is the provider. So who ordered that medication and the primary provider that's responsible for the patient. In addition, if appropriate, right, if it's necessary, you may have to administer treatment depending on the reaction. So treatment can vary depending on the severity of the reaction. You may give antihistamines. Sometimes you may need to give glucocorticosteroids, and then so on. Again, it depends on how the patient is doing. So again, it's important to examine your patient or assess your patient. In addition, in the future, you may have, so if for some reason there's no alternative to the drug and the patient absolutely needs to receive the medication, then in the future, when you're going to administer that same or similar medication, you may have to prophylactically treat the patient if needed. Usually, if there are other alternatives, then we'd rather do that because we don't want the patient to have, a severe reaction to it. In addition to that, as always, part of our responsibility is to educate our patient. We need to let them know your basics, right? Why are they getting the medication, common side effects, and what to do if they have a severe reaction to it, and so on, and definitely answer any questions that they may have. Now, if a patient is having an anaphylaxis or anaphylactic reaction, or possibly having anaphylactic shock, this is a medical emergency. So if you're in acute care setting, or even if you're not, definitely this warrants activation of an emergency response. So whether you call 911 or you push the code blue or rapid response. I said this one, I would say code blue, just to get everyone there earlier, because if somebody's having an anaphylactic reaction, they may actually go downhill pretty quickly. So you have to act fast, and this is an emergency. Whenever we're giving medications, as you guys know, there's really no medication that doesn't have some sort of an effect to our patient. Some medications may cause tissue or organ damage. Examples: they may have dermatologic reactions, basically skin reactions, rash. So that's not that serious. For some types of medications, such as antibiotics or maybe some immunosuppressants, it can cause superinfection or severe infections, typically that are hard to treat. It can cause blood dyscrasias. Blood dyscrasias are basically abnormalities in blood count. Toxicity, any form of toxicity, alterations in glucose metabolism. It can either increase or decrease their glucose levels. Electrolyte imbalance, same thing. So depending on the medication, some electrolytes may go up, some electrolytes may go down. Sensory effects, so it can affect their hearing, their vision, their sensation. Neurological effects, it can cause numbness, tingling, and again, other neurological signs and symptoms. And then some medications are known to be teratogenic. So teratogenicity is basically their effect on the developing fetus. So knowing that, we have to be very careful when administering medication. And that's why it's also very important to know if a patient is pregnant or lactating, because of its negative effect to the developing fetus or the baby if it's passed through the breast milk. Nursing process in drug therapy and patient safety. So whenever we're caring for a patient and we're giving their medications, we have to really look at the nursing process. This is now being somewhat replaced by the clinical judgment model, just because of our new testing format, the NGN format of testing. in NCLEX or next generation NCLEX exams. But anyhow, so nursing process and the clinical judgment model, they kind of overlap. They're very similar. But anyway, so nursing process is a research-supported organizational framework for professional nursing practice. It kind of gives us like guidelines to follow to make sure that we're delivering quality care to our patients consistently. So this too requires critical thinking. So we have to kind of have some sort of a knowledge and be able to prioritize and make decisions based on what we are seeing and what's going on with our patient. So the nursing process is ongoing and constantly evolving, basically changing depending on the needs of the patient and what's going on around us. So the nursing process has 5 steps. It has assessment, nursing diagnosis, or now it's called human statement or problem list, planning, implementation, and evaluation. So in assessment, this is our time where we gather data. So checking the vital signs, getting their history, and so on. Nursing diagnosis or human statements or problem list, this is basically when we kind of list or enumerate what we think is going on with the patient, what is concerning, what is wrong with the patient based on our assessment. Planning, on the other hand, is straightforward planning. What is our goal? What is our timeline? By when do we want to accomplish it? What do we want to accomplish based on what we know so far? Now, implementation is basically because of all the stuff that we assess, the problem, and then the plan. This is now time to implement, to actually act upon our plan. So this includes initiation of a treatment or interventions. And next, whenever you do something to a patient, you always go back and evaluate for effectiveness, and at the same time evaluate if the patient is experiencing any adverse reaction or side effect from whatever medications that we are giving or whatever treatment or procedure that we have done. So evaluation is checking for therapeutic response or the lack of response. Now, the clinical judgment model is very similar. So number 1 would be recognizing cues, which is basically looking at the data, right, as part of your assessment. And number 2 is analyzing cues. So in here, we don't necessarily have an exact idea of what it is exactly, but we're just analyzing. We're looking at the patterns, the trends. What are the possibilities? What may be going on with the patient? Number 3 is prioritizing hypothesis. So based on everything that we've collected, what do we think is wrong? What is likely going on with our patient? Number 4 is generating solutions. So based on what we think is wrong with our patient, now we start coming up with certain solutions. How are we gonna fix the problem, right? What are the things that we need to do to hopefully alleviate whatever the patient is feeling? And then number 5, once we have an idea of what we're gonna do, then it's time to actually do it, right? Take action. So this is when we administer the medication, we get, patient ready for whatever procedure and so on. And number 6 is gonna be basically the same thing as number 5 from your nursing process. So number 6 in clinical judgment model is evaluation of outcomes. So again, this is when you go back, you evaluate your patient. Again, you assess the patient and kind of determine, is whatever intervention that you implemented, is it working for your patient or is it not? Or is the patient now experiencing an adverse reaction from the treatment? So this is when we go back and reassess our patient. Elements of medication order or prescription. So whenever a doctor is writing an order or prescription of a medication, we need to make sure that these are included. So the drug name, the dosage, so how much of that medication we are going to give, the route, is it IM, sub-Q, PO, and so on, frequency, how often are we going to give it? In addition to that, if they're going to write a prescription, on the prescription pad, it needs to have the patient's name and date of birth and address. Nowadays, usually if you see it, especially when they're writing a paper prescription, sometimes they don't even include the address. They kind of leave it blank, but at least the name and date of birth. And then the date, the refill, right? If they want the patient to have more refills, any possible substitution. Can they substitute it with a generic or could they not? And then make sure that you have your provider signature and their information. Usually it includes their license number and so on. But yeah, so those are the minimum, right, that you need to see when a provider is writing medication orders or prescriptions for a patient. Prevention of medication error. So preventing and responding to medication errors. So what we know about medication errors, these are preventable. Unfortunately, these are common causes of adverse healthcare outcomes. And as we know, even when we're giving medications the way we're supposed to be giving them, patients can still experience adverse reaction. But how much more if this patient actually is not supposed to get this medication, or maybe we gave them the wrong dose or the wrong drug, right? And so this can actually lead to very severe or negative effects to our patient. So drugs commonly involved in severe medication errors include medications that affect the central nervous system, medications that are basically affecting our patients' coagulation, so anticoagulants, it can cause severe bleeding, and then chemotherapeutic drugs. And when you look at this, some of these medications actually require another nurse to double check because of the consequences that's going to be involved if we give these medications incorrectly. And that's why sometimes we have to have a second person, a licensed person, to double check and validate that, that's we're doing what we're supposed to be doing. So more potential for harm with high alert medication. So they're going to be your high alert medication. You're also going to see SALAD or SALAD, or LASA or LASA. So SALAD is sound-alike, look-alike drugs, and then LASA is look-alike, sound-alike drugs. So these are medications that sound alike or look alike. And so whenever you are giving this type of medication, just kind of pay very close attention to how they're written. Most of the places now, they kind of change the capital letters and small letters to emphasize that these medications are different from the other, just to prevent medication errors. So again, most medications errors occur not because of nurses' negligence, because typically you'll hear it a lot. Nurses get to be blamed for a lot of things, but in all honesty, when errors happen, it's not usually the person who is at fault. It's actually a problem within the system. So typically, medication errors happen because of a breakdown in the medication use system. So something in the system is broken and needs to be fixed. And so again, it is incorrect when people blame the nurses all the time. Usually there's a system error. So again, most medication errors occur as a breakdown in the medication use system, as opposed to being the fault of the individual, specifically the nurses. Issues contributing to errors. So there are different factors that can lead to medication errors, and they can happen within a certain point of the medication administration. So errors can happen during any step of the medication process. So whether it's procuring or gathering all the ingredients, prescribing. So when the doctor is writing the order, or the NP or PA, or the provider, or when there needs to be a transcription, so it's being transcribed. Maybe somebody said it verbally and somebody has to type it. Also, sometimes dispensing, so everything is right, but when it comes to actually dispensing or distributing or giving out the medication, we are given the wrong medication, and then some errors happen during time of administration. Maybe it wasn't administered correctly, or maybe there was more that was administered, or monitoring or failure to monitor can also lead to medication error. Like I said, there may be some organizational issues, maybe short staffing, maybe assigning certain patients to a newly graduated nurse who really is not prepared to care for that acutely ill patient. And then educational system issues. Maybe the schools are not teaching our nurses appropriately. And there are other factors like sociologic factors. And then another common one would be the use of abbreviations. So again, we have to be very careful. If we can avoid abbreviating, that would be great. I think that will prevent some of the errors that we are seeing when administering medications. So these are some strategies to minimize or prevent medication errors. This is not all of it, but I think that these are very important steps that maybe we can follow in order to prevent it from happening. And so awareness. So basically, if you see something, say something, right? Because what you don't want is maybe you catch something and you don't say anything, but then what if the other person that's about to give the medication doesn't catch it and actually gives the medication, right? In addition, the computerized prescriber order entry. So back in the day, everything used to be like written. So sometimes it's hard to understand. So now with the computer system, it's easier because now you can understand what they are ordering. Barcode and scanning devices, making sure if available to always use the barcodes and scan your medication. Now we have the automated dispensing machines, which really doesn't allow us to pull out medication other than the medication that's in the patient profile for the most part. Effective communication, right? Making sure you're clear when you're communicating, and then repeating and clarifying things if it's not clear. And then there are multiple ways to check, and so there's so many people that are basically supposed to check things and make sure that whatever it is, it doesn't get to the patient if it's the wrong medication or the wrong dose or whatnot. Now prescribers must write legible orders that contain correct information, or orders should be entered electronically. And then we have authoritative resources such as pharmacists. Now, most of the hospitals will have a pharmacy even in their unit that you can actually ask. Then you also have drug reference guides, literature, and really we have so many ways to really verify. So again, if you're in doubt, right, always verify, ask for help. Use your resources. Don't assume, especially when you're giving a medication, because again, that can lead to very negative consequences for your patient and also for yourself. You may lose your license because you were negligent, right? And you don't want that to happen because you worked so hard to get here. Now, nurses need to always check the medication order 3 times before giving the medication. The 6 rights, well, now we have 8 rights, so disregard. This is 8 rights of medication administration. Make sure we're following it every time for every patient, for every medication that we're giving. Assessment, making sure you're checking your patient, using 2 patient identifiers, which is typically the patient's name and date of birth. And definitely follow your hospital policy, and do not administer if you did not draw the medication. So if somebody gives you a syringe and they say, give this medication, don't just give that medication if you don't even know what's in there. So ideally, I highly discourage you to give a medication that you did not draw or did not see being drawn. Now, it's different if somebody's coding and you just have to kind of, give the emergency drugs. That's different. But typically, on your regular medications, if you did not draw it, if you don't even know what's in there, if you did not put it in the medication cup, don't give it to the patient because you don't know what's in there, right? Minimizing verbal or telephone orders, that really prevents like errors from transcription. Making sure that you're repeating orders to the prescriber if they end up giving you a verbal or telephone order. Make sure that you're spelling the drug names aloud, especially for the medications that are sounding alike or looking alike. Speak slowly and clearly, and then list the indication next to each order. So know why you're giving each medication. Indication is basically the reason why the patient is getting the medication. And then never assume anything about items not specified in the drug order. So if it's not written, don't just say, oh, probably it's IM, probably sub-Q. No. Any information that's missing, you don't assume. You call the doctor or the NP or whoever to clarify that order. Don't assume. And do not try to decipher things that you can't even read, right? Again, contact and clarify. Save your patient. Save yourself. Do not use unapproved abbreviations or acronyms, and never use a trailing 0 with medication order. So example, for 1 milligram, don't use 1.0 because sometimes they may not see the decimal point and they may end up giving 10. So that's 10 times more the appropriate dose for the patient, right? And similarly, always use a leading 0 for decimal dosages. So if the order is 0.25 milligrams, don't put 0.25 milligrams. You have to put the 0 before the decimal point, because what happened is this can be misread as 25 milligrams, and that's insane. That's a lot more than what you're supposed to be giving your patient. So again, Never use a trailing zero, and always use a leading zero for decimal dosages. And then take time to learn special administration techniques, and take advantage while you're in nursing school. Use the skills lab. Make sure you're comfortable with those skills. And then always verify new medication administration records. Read the labels, and then use generic name. Avoid using trade names as much as possible, especially if they're starting to sound alike. And always listen to and honor the concerns of the patient, because they know their body, they know how they feel. If somebody's telling you, I don't feel good, you have to listen to your patient. Don't just ignore. It is so easy to just kind of go with our day, just get our checklist, our task done, right? But if somebody is expressing their concerns, you have to listen to them, because most of the time they are right. And the minute you stop listening to your patient, that is when something bad may happen. Anyway, make sure you're checking allergies, identification, know where to find information, use current resources, and then for some medication, it is mandated to have a second nurse verify it. And make sure that they actually verify it, not just sign it. Because I've seen so many times that nurses, okay, that's fine, I'll just sign it. No, verify it. Even if they say, you're good, I'll sign it. No, just show them the syringe, show them the medication. Because at the end of the day, if something happens, right, who's going to suffer? Your patient. And who may end up losing their license? Most likely, you may end up losing your license, right? And again, you didn't work this hard to harm a patient or basically lose the license that you worked so hard for. And then again, we try to minimize interruptions. If we know somebody's preparing a medication, administering a medication, we shouldn't be interrupting or trying to have a conversation with them, because again, we want to prevent any medication errors. Medication reconciliation. So medication reconciliation basically involves continuous assessment and updating of the patient medication information. So we verify, we clarify, and reconcile the medication. So at any point, whether something is changed with the patient during admission, when we're transferring a patient from one unit to another, from one facility to another, or we're discharging a patient, we need to look at the list of medication and together with the provider. So we're going to collaborate with the provider and really clarify which medication can they continue, which medications will be discontinued, is there any changes that we're going to do, so that we don't lose track of their medication. The last thing we want is we don't do that, and maybe they weren't supposed to continue taking that medication when they get transferred to that facility. And now we end up giving that medication for a prolonged period of time, and it does affect their kidney function, and so on, right? We don't want to miss anything. So it requires us to constantly verify and clarify and check to make sure that the list of medications are accurate when the patient are being moved from one place to another or being admitted or discharged. Anyway, next would be our role in medication administration. So as you can see, our role is quite extensive when we're giving the medications, right? Because we're the last person that's going to touch that medication before it reaches our patient. So speaking of reaching the patient, before it reaches the patient, we have to perform the 3 checks of medication administration. So what are they? Number 1, we check the medication when we're pulling the medication. So on first contact, as we're taking it out of the Pyxis or Omnicell or whatever dispensing system your hospital or facility has, we check it then. We look at all the details. Is it for the right patient? Is it the right medication, expiration, and so on? So we check everything then. Then, once we pull it out, we check it again for a second time around as we're preparing it. So as we're opening the medication or as we're pouring it, during the preparation process, you verify, is this the right bottle? Is this the right medication that I'm pouring? Again, this is a time to check again. Make sure that that's still the right medication and that you didn't accidentally pull out a different medication. And then last but not the least, when you're in the patient room, right before you administer the medication, you check it again, right? Make sure, is this the right medication? Is this the right medication for this patient? So you're going to check it prior to administration right there at the bedside. You don't check it right before administration in the med room. Because guess what? You may get sidetracked and you end up going to a different patient room, and then now, like you may have grabbed the wrong medication or left it somewhere, or something must have happened, right? So again, the last check is in the patient room while you're with your patient before you give it to your patient. Please memorize this. Special circumstances. So there are some medications, like I said earlier, that need to be double-checked, cross-checked, or co-signed with another licensed personnel. So typically in the hospital, it's a nurse-to-nurse thing. So you will usually ask another nurse to verify it with you, not just sign it, right? They need to physically look at it and make sure that you're giving the right drug, the right, everything is right in order to safely administer that medication. So here are some medications that will always need to be double-checked by another licensed personnel. So please memorize this. An acronym that I came up with is HIP-CT, HIP-CT. So always co-sign or double-check your HIP-CT. So what does HIP-CT stand for? Heparin drip. So this is a medication that is used to basically prevent clots from forming. It can cause severe bleeding if not done correctly. So that's we're required to double check that. Insulin needs to be double checked. Patient-controlled analgesia is basically a type of medication that is administered through a pump wherein the patient has the ability to press the button whenever they think that they need the medication. So just to clarify, this doesn't mean that all pain medications need to be co-signed. It's just specifically patient-controlled analgesia or PCA medications that need to be co-signed. Other medication that needs to be co-signed is chemotherapy. Pretty straightforward. Chemotherapy usually is pretty toxic, so it is very important to make sure that we're giving the right dose, the right medication, and so on, and somebody else kind of verifies it with us. And thrombolytics are medications that are used to break down existing clots. The problem with that is because they're so potent that way, it can actually cause severe bleeding. And so it is very important that we have somebody double check and making sure, again, everything is correct in order to safely administer that medication. So again, the medications that need to be double checked are heparin drip, insulin, patient-controlled analgesia or PCA, chemotherapy, and thrombolytics. Please remember this. In addition to that, whenever you're having a hard time calculating a medication, definitely ask somebody to double check it with you. And some other times, if the drug strength, if even a slight change in the dose can cause severe toxic side effect, or it can be lethal or can cause death, then you may want to double check it with another licensed personnel. Anyway, 8 rights of medication administration. I'm sure you guys already know by now. This is something that you have to know from the beginning of this program till the end of the program and when you're practicing as a nurse. So 8 rights of medication administration. Basically, these are the things that you have to verify and know before before administering a medication in order to ensure that it's safe to give to your patient. So 1, you verify that you have the right patient, right? You verify that you have the right drug. You verify that you have the right dose, route, the time and frequency. Make sure that time and frequency go together. If you answered time alone or frequency alone, that's going to be incorrect. So make sure you put it together. Documentation is very important. So as we say in nursing school, if it wasn't documented, it didn't happen. And last addition, it used to be 6 rights. Now we added 2 more things, reason and response. Make sure that you are checking that medication is being administered for the right reason and response. So make sure you evaluate your patient and check and make sure that they're having the appropriate or expected response from that medication. Another responsibility of nurses would be patient education. As I mentioned before, it is very important that we educate our patient, and at the very minimum, we need to let them know what medication they're getting, why they're getting that medication, and any potential side effects or anything that they need to know in order to care for themselves, especially when they're by themselves or at home. Patient's role. So what is the patient's role when it comes to medication administration? Really, their role is to be informed. They need to ask questions. They need to advocate for their own selves. And unfortunately, some, depending on the culture, personality, and so many other factors, some patients either they don't know or they just don't, right? And so, but generally speaking, we want them to be informed. We want them to be asking questions, and we need to let them know that they need to report any signs and symptoms or any concerns that they may have, and definitely they need to speak up. If they see something, they feel a certain way, they have to speak up so that we can address it appropriately in a timely manner. Now, reporting medication errors. So, unfortunately, like I said, medication errors can happen, and so when it happens, we are mandated to report it, and we have to report it. It's very important to report it because that's our way to, one, monitoring and also trying to figure out what is going on, what is causing all these errors. And at the same time, our hope is that if we continue to report this, we can figure out, a solution to this problem, hopefully prevent future medication errors. So when an error happens, we need to make sure that, one, we report it to the prescriber and the nursing management, right? Definitely we have to follow the hospital or facilities policies, but one of the first people that we have to notify are the prescribers and the nursing management. Also, we have to document the errors per policy. So if there's a specific document or some form that we have to complete, definitely we have to do that. And then we want to make sure that when we're documenting it, we need to document the facts, right? Not what we feel, what we think happened. We actually need to be very accurate, right? So what happened exactly? So examples of things that we need to include in that documentation would be what medication was administered, what was the actual dose, what were the observations, like how was the patient, right? What was the condition of the patient? And was the prescriber notified? Were there any follow-up orders from the prescriber? In addition to doing an internal reporting, most facilities will also do external reporting of errors. So we can report it to the United States Pharmacopoeia Medication Error Reporting Program. Also MedWatch, which is sponsored by the Food and Drug Administration. Then we have Institute for Safe Medication Practices, and then the Joint Commission. Depending on the facility, there are some places where they're actually mandated to report, and there are some that are somewhat optional based on their accreditation. If they want to be accredited by the Joint Commission, then they may want to report, those errors. Or else, if they want to be accredited and the Joint Commission visits and they find out that there were errors that were not reported, then that's not going to look good for that facility. Well, anyway, this is what I have for you guys for now. Please let me know if you have any questions. I'll see you guys soon.